Good morning, everyone. It's 10 a.m. Suriname time and 9 a.m. in Trinidad. I want to take this opportunity to welcome you all to our session this morning, where we will be looking at business continuity planning and also touch on safe return to work guidelines. I want to take this opportunity to thank colleagues from VSB, Mr. Kamlesh Ganesh, together with Mr. Paul Torilal. We've been working with colleagues from VSB to organize this session, and I'm very happy that you are all able to join us at the comfort of your home, and we're looking forward to a very fruitful discussion. I also want to take this opportunity to thank and welcome our facilitator, Mr. Robert Teelucksingh. Mr. Teelucksingh has worked with the ILO for a very long time on issues pertaining to OSH and business continuity planning. So he comes with a lot of experience, particularly having worked with many of the employers' organizations in the Caribbean. So we are very happy to have him here with us. We've also had similar sessions that we are having today for VSB members. We've done similar sessions for employers' organizations in Trinidad, in Grenada, and yesterday we had a session with Belize. The session has been really informative, and the feedback has been very positive from participants. Also, let me acknowledge my two colleagues, Angela Colley and Abigail Toussaint, who will be helping us with coordinating the session, and hoping that we do not have any technical issues. But should at any moment that any of you gets cut off from the session, please use the same link to come back into the meeting room. Let me also take this opportunity to apologize. I understand there may have been some challenges with the time that you would have received when you registered. I think the time zone issue created some challenges, but I'm very happy to see that we now have about 56 of participants tuned in today. So apologies for that. In terms of the program, we will have the first presentation on the business continuity program. Following that presentation, we will take on questions and comments. And here, I will be, of course, assisted by my colleague from VSB and the facilitator to respond to any of the questions that you may have, and my colleague Angela will help me to collect all the questions. And then we will have a 10-12 minutes break to allow you to refill your energy drink, coffee, water, tea, and we will come back again to the session where we will touch on the return to work guidelines. And after the presentation on those guidelines, we will then take more questions from yourselves, and then immediately after that, we will close the session. In terms of the rules of the webinar, just to make sure that we run it smoothly, your microphones have been disabled. There are opportunities for you during the question and comment time to make a contribution. You can either indicate in the comment if you want to speak. We will therefore unmute your mic so that you can ask your question or make a comment. Or you can type into the chat box your question. We will collect all the questions and present them during the question and discussion session for the facilitator to respond to your question. You can just please note that the session will be recorded, and every participant will get the recordings. The recordings together with the presentation and all the attachment will be sent to you from VSB. So you will receive all the information. And I suggest you have your you have enough coffee, tea to take you through the entire session. Now, without further ado, I will then ask Mr. Teelucksingh. Angela, you can stop sharing the screen so that Mr. Teelucksingh can share his presentation, and we begin. Welcome you all. I understand that there's been quite a lot happening in Suriname. I mean, in addition to COVID-19, you also recently had your general elections, and I believe that you know, despite having no cases for some time, you've now seen a spike of cases recently, and all of you have been asked to work from home. And I understand that, you know, more guidance and information will be communicated from the government in terms of the shutdown. Of course, in the region, in the Caribbean region, countries are at different phases in terms of the lockdowns. We've seen in Trinidad, we've seen in Barbados, in Belize, in Jamaica, more businesses beginning to open up, and the government allowing some activities, some business activities to proceed. But of course, the situation is not the same in all of the countries. It depends on the number of cases and the extent to which countries are able to flatten the curve. Without further ado, Mr. Teelucksingh, you ready? You can start sharing your presentation and we can proceed. Welcome you all.
Good morning all. Good morning, Vanessa, and thank you very much. Okay, we are going to start now with the presentation. And great. Right. So I don't know how many of you attended the workshop we had in 2018, early 2019 in Suriname, where we talked about business continuity planning. And that was a full workshop. This is a 6-step introductory in how you can start putting your business continuity plan together and help you work it through, especially due to the fact that you're now looking at this COVID-19 experience and other things that you need to look at. So I hope it's helpful to you, and we will go through it, and I hope you can get everything you need out of it. What are the benefits? Well, one of the first benefits is that you will develop a effective risk contingency system for your business. Your ability to identify and to put mitigation strategies in place to handle those risks. All right. Establish a risk profile for your enterprise. Where are you in terms of other organizations, or where are you in terms of what needs to be done? One of the areas you're going to be looking at is people, processes, profits, and partnerships. And you'll hear this all through the presentation because we've broken it up into these 4 groups. Okay. Now, what the ILO has done is that they've given you a self-assessment profile. And before I show you what it looks like, there are 61 questions. They're broken into the 4 groups: people, processes, profits, and partnerships. It's a yes or no. Either you have it or you don't. And what that will do, that self-assessment, will tell you where is your organization right now in terms of COVID-19. It's especially made for that, but you can change your questions to deal with any type of hazard. But it's a very excellent process. I recommend it to you highly that you do this first before you do anything else, and you see what your risk profile of your organization looks like. And then I will help you in using that information in creating a mitigation strategy, a risk mitigation strategy for handling those risks. Okay, so let's have a look at what the profile looks like. Oh, sorry. Having this problem again. Previous. Right. So This is the profile. Can everybody see it?
Yes, we can see it, Robert.
Great. So part one, establishing your risk profile. The question is clear under people within that matrix. Is there a current personal safety risk, such as a high number of COVID-19 cases in your geographical area of your operations? In other words, is your operations or even part of your operations located in an area where there have been some incidents of COVID-19, either and one incident or two or whatever. But now that you're now going into it, you may not see a lot of it, but basically it's yes or no. What does that mean to your organization? It means that you have to take the precautions that are needed to protect your workers and your facility, your clients, your suppliers, and everybody who comes in contact with your facility. So how do you do that? And that's where the other risk is. So let's talk about this one. Like I said, this is it. It's people. You go down it and you will follow it all the way through. At the end of the whole process, they will ask you to look at the number of times you've said yes. You add up the score versus the 61 questions, and it will tell you where it is that you sit in terms of the whole risk profile. All right, so this is a very simple risk profile to do, and it's self-explanatory as you go through it. What I have done is taking those very same questions and put it onto another risk assessment form, which you will get from your association, because we will send it to them. And it's broken up into the 4 areas of people, processes, profits, partnerships. And the reason I did it not on one form, but I broke it into 4 different forms, is that one person cannot do this all by themselves. So you may want to pass the part with your processes or operations onto your operations people to do. You'll want to handle the people part by yourself or with your HR people. You would want to handle your profits with your financial director or the person responsible with your finances. So you have a better idea of what you're dealing with. Again, I've broken it up into 6 different categories. The protocol, which is the same question as what you saw on the self-assessment, yes or no. But whether you say yes or no, you will decide, do I need to put something in place if I don't have something in place? And what existing controls do I have? You may already have some partial controls in place, such as washing of hands before entering the workplace. But are there other things that we could put in place that will safeguard your employees, your clients, and so forth? So you will put that in this control box here. So you will write that in. These are what we have existing and what we need to do. Then you will do a risk profile. 1 being low and 5 being high is the numbering system. You're looking at the severity of it. The severity is, if somebody gets infected, how bad will that impact on that person or on your organization? And what is the likelihood or the probability of it happening? And that will give you your risk matrix, okay? So in this case, I would say, because of what I have seen and read recently, I've been doing some research, I would say that you have a very low risk profile right now. So we'll go with a 2, right? I mean, severity will be about, if somebody does get it, it will be a 4. But your probability is very low at the moment. So I will go with a 1 or 2. That will give you an 8, which is your risk profile. Now, don't get confused. It's very simple. You don't have a lot of maths. You need to look at what are the data that's available to you in making these decisions. You know that the severity of a COVID virus is very high. It can lead to death. So again, depending on how it impacts on your organization, it will be a 3 or 4. But the probability of it happening because of the existing controls you have in place, it will be 1, 2, or even a 3 or 4. But you're looking at an 8. If you put a 5 here and a 5 here and you get 25, that means it's happening. You've had several cases. It's critical. So you need to make a decision. And one of the decisions, unfortunately, will be to close down. All right? But we have to look at that. What additional controls can we put in place? You then put those additional controls, what are recommended by your Ministry of Health or by your labor government and so forth to put in place. Right now, everybody is at home, working from home. So that's part of it. So what is severity? It would still remain the same if you get it. Whether you get it at home or you get it on the job, the severity will remain the same, a 4. But the probability will now go down to a 1 because it's less likely. You're not exposed. You're not exposed to that many people or that much environment. So now you will come down to a 4. So you have changed your risk profile from an 8 to a 4. You've reduced it. And what does that really mean? Well, at the bottom of the chart, when you go to the end of the chart, you will now see your risk ratings. Severity versus probability gives you your risk rating. From 1 to 6 is low. From 7 to 14 is medium. And from 15 to 24 is high. 25 being critical. So what you would like to look at is that you have just gone from a medium to a low risk rating. So you understand how you have done this. Now, these are things that you may not have in, the additional controls may not be in place as yet, but this is what you're planning to do. So you're using this as a tool to assist you in answering the questions in the self-assessment, but also taking it a step further. What do I need to put in place to safeguard my operations or my people or my business? And what else can I do in order to reduce it even further? So it's a working tool. You can bring, give one to the different areas within your organization to do it, come together, go through it, come up with a plan, what's first, what's second, based on the risk rating. And that way you have now a tool for moving forward with your BCP program. I hope everybody understands it. I'll take the questions later on. So that's basically how this works. These will be, these forms are free for you to use. They're coming to you at the end of the program. Okay? All right, so let us go back to the program. Right, so we have done that. All right, and again, interpreting your score at the end of, at the bottom, it will tell you exactly what your score is. And more important, it tells you where you are in terms of your risk, in terms of your workers, your supply chain, your resilience to third parties, and so forth. I just talked about the self-assessment with the ones I sent you. So what are the phases of this BCP program? Well, like in any other disaster preparedness or so forth program, you have prevention. What do you have in place now? What decisions do you have to make to plan and successfully address the mitigation strategies you want to put in place? For example, if you have a, if your stock is located out of your main operations on another part of the island or another area, then you now will have to decide, is there a risk there of me being isolated from getting my stock in on time? Is the area where my stocks are located, my warehouse is located, or even the person delivering the stock, the supplier, could they be cut off from me at any point in time by a bridge going out, by landslides, by having no trucks? So you need to look at that. And then you make a decision, how can I lower this risk of a disaster? I may not have no control over the disaster, but I have control over the stocks. So I may decide to do stock, holding stock on site in a larger bulk that will keep my operations going based on what I see my needs are. Whether you want to do 1 day's worth, 2 days, 1 week supply, always on site. So therefore, you know, if anything goes wrong, you have enough stock on site to keep your operations going. And that's the process you're looking at in what do we do to prevent me from closing down. Preparedness. This is when you actually ensure that you are prepared. You have written a plan. You have communicated this plan to all your stakeholders. You have trained your employees. Very important. There's no way that you can just write this plan and expect everybody to participate and know what to do unless you train them. And the other part about it is that, have you tested the plan? I've gone to organizations where they've had beautiful business continuity plans, but they've never even tested one part of the plan to see if it works. If you don't test that plan, You don't know if that plan will work or if everybody is able to do what you're asking them to do in the plan, even with training. So what is the reliability of your alternative source of supplies? Who establishes first contact with them? At what point in time do you look for alternatives to your needs? And who do you go to? And who makes that decision? And who makes that phone call? So all of these things have to be in your plan, but you need to test it. You need to test it to ensure that it does work. Response. That's when the impact has happened. Right now, you've just had the impact of COVID-19. What was the response? The government has asked you to work from home as much as possible. Only essential services are operating. So how do we go about this? The lessons learned that you had from testing the plan will ensure that all the hiccups that you had in the plan have been taken care of. So everybody is on board. And you want to see that the plan is running and is running smoothly, right? Your contact to alternative suppliers, any chain disruption in terms of supplies into your organization. Even within your organization, how is that running? How are people coming to work? How are they keeping themselves safe? And we'll go into that later on. But these are the three areas. Now we'll start looking at it on a phase basis. Basically, if you're looking at it, the BCP management, business continuity management, equals preventative measures, preparedness arrangements, which are all prior to the disaster, and then the response option is when the impact or the disaster occurs. So that simplifies it right there for you. What's your first step? Identify your key product and services. Many of us have started off doing one thing, and this is what we built our businesses on. But within those years or time, we have realized, look, there's another niche market here for something else, and there's something else, and there's some. So we have about 3 or 4 different products that we're involved in. And what you have to determine is, what is your essential or core product that you're doing? And are you going to continue with this even at a reduced scale? What do you need to continue with it? Raw materials, the human factor, people, workers, financial resources. What external requirements do you need in terms of supplies, transport, for getting your raw materials in and getting your finished product to your clients? All right. Is this going to an external source? Are you exporting most of your product? Is that a larger part of your sales market? Then with this COVID virus and certain things going on, is that export still available to you? Can you do the exports as the export market there, or do you have to look at increasing your internal market? So all of these things you have to look at when you're looking at your key product and service, right? Identify those internal and external dependencies in the risk assessment in terms of the people, process, profit, and partnership. Look at each of these differently. Identify what else can affect your business. What are the external hazards? Well, guess what? Today's June 3rd. We are already into the hurricane season. We are going to have a lot of rain starting in a little while. So we are looking at flooding. We're looking at all of these other types of man-made, nature disasters that are coming on top of the coronavirus. So how are we going to deal with this? How does it affect my suppliers, my goods, my services, my market, and my overseas market? Government standards and regulations. The government will increase their regulations in terms of how you work, what you can and cannot do, even hours of work, even restrictions in terms of exports and imports. So if the borders are closed and you are not able to get your goods out or goods in, what do you do at that point in time? Restrictions of access and port of movements of goods and services, reduction in water, electricity, public transport. Right now in Trinidad and Tobago, we're in our 3rd phase of this opening up from COVID-19, but we are still at a point where our public transport could only carry 50% of what their licensed capacity is. So if somebody has a maxi taxi which has a license capacity of 18-seater, right now, he cannot have more than 9 people in that taxi, including the driver, because the driver has to be isolated as well. So how does that impact on people coming to work? You have the same amount of people trying to get to work sometimes, or from the same area to get out, but less service available to you. So these are things that you need to look at. Consider the following. What share of income is generated by which one of your products? Which one of them generates the highest amount of income? And are they still able to generate that? Is the income on a yearly basis, quarterly, monthly, or seasonal? Some of the companies I've worked with are seasonal organizations where they only produce something during the latter quarter of the year or the beginning of the year. So the rest of the year is spent getting ready for this, and that's when they make their profits. So their job market, as well as their market, sales market, is a seasonal one. How do you deal with that? Right? What are your clients demanding of you? Right? Quantity, how often, right? What are your clients' demand? How often do they need to get the product? Cost of delivery, negative financial productivity, reputational loss. If you cannot deliver, or if you cannot deliver the quantity that your client is looking for, what is your financial loss, one? And what is your reputational loss to the organization? You may not be able to increase your productivity by increasing the amount of hours you work, because you're working with in social distancing. So therefore, when you had 10 people working on a production line, you only have 4 to 5 now. So they're not able to produce the same amount of widgets that they were before. But even if you bring another shift on, the time period in which you're running it, you got to look at your cost, availability. Can they work at that time? Do they have the ability to go to and from home? Is there any curfews involved? All of these things is what we have to look at as they come on board. Your product service is essential service, your supply chain. Look at your suppliers. If there's a third party between your supplier and you, the guy who transports the good and the raw materials, he's only contracted by your supplier or contracted by you. What if something happens to him? The supplier has the goods, you have the need, but we don't have anybody to get the goods there. So that's something you need to look at. That's part of your supply chain. And you need to look at every component in that supply chain. From the time it arrives, it leaves the place of origin, let's say it will be another country, it arrives at your port, from your port to the supplier, from the supplier to you, from you to your client. That is your supply chain, right? Essential services. What is needed? Are there medical requirements? Power generation, security, maintenance for keeping your plant going, right? Daily requirements, such as for your staff. They need to have groceries, pharmaceuticals, transport. How is that running? How is that happening? Okay, in Trinidad and Tobago, our groceries for a good while went to a point where they limited how many people can go in. And you had to wash your hands first. You had to wear your mask at all times. Okay, so therefore, people picked for certain days to come and purchase their groceries, because otherwise you will have lines going out the door all the time and social distancing will be out of the window. All right, so other things to look after: suppliers of gas, food production, media, print, electronic print, to keep up with whatever news that needs to be going out. So all of these services you need to look at, and how does it impact on your operations? If your product and service is an essential service, if you are a grocery, food producer, pharmaceutical importer, any one of these people, or even if you manufacture pharmaceuticals, and it has been deemed to be an essential service, what is your time critical operations? In other words, what is the shortest period of time you can operate with respect to others? That's called tolerated downtime. If you cannot operate in your full 8 hours a day, what is the shortest period of time you're allowed or you can operate? And where does the cost come in? Where did that cost become unaffordable because you're not making the money you need to make by that? What happened? We also have to look at your product. In Trinidad and Tobago, many of our distilleries decided that, well, guess what? Bars will close. Alcohol is not selling. So what are we going to do? Well, guess what? People need hand sanitizers, which is 85 to 90% alcohol. So they went into the hand sanitization business of making hand sanitizers. So their production was still there. It may not be at the same rate or the same height. They may not have made the same amount of money, but they were able to keep employment going. They were able to keep the organization going, and they were able to supply a market of something that was on demand. So you have to think out of the box, right? The impact on your reputation of your business, right? If it is that you have to supply something that is considered essential and you're unable to make that at the quantities you used to do it before, people now look at you and say, well, you know, what's going on here? Why can't you give us more? All right. What are the supplies? What are the cost factors? Your cost factor may have gone up in terms of your raw material. So therefore, your end material will also reflect that cost increase, right? Financial services. Start with budgeting every activity. Look at the cost of every activity you're putting into place. People take some things as being, oh, that's minute, that's okay, we can handle that. But then when you add that up at the end of the month or the end of the year and you see the cost factor associated with it, you say, wow, I didn't know this was going to cost me this much. I didn't realize that this was going to take such an impact on my financials. Cost out everything. Look at budgeting for doing everything, from training to retooling to movement of goods and services. What is the cost to you? One of the good ways of doing that is using, everybody's familiar with the fishbone diagram. It will show you how to look at equipment, processes, and people. What are the secondary causes? What are the primary causes? What are the effects? What is the problem? And you're able to look at it. One of the things about the BCP program we said before, it's going to help you to be able to identify those problem areas that were in your production that you weren't previously able to look at or identify, or could not, or at that time, maybe you didn't want to deal with it at that time, but now it has come to the forefront and you have to deal with it, okay? So it will help you in terms of the management of your organization. Establish the objectives of your BCP program. What is your main objective here? Resilience. In risk management, we like to say that the reason for risk management is that no event or series of events will cause the organization to close down. So if we can anticipate those events, we can build resiliency. The capacity of the organization to quickly adapt to disruptions while maintaining continuous business operations. And that is the key point, continuous business operations, right? While safeguarding your people, your assets, and your overall brand quality. All right. Besides the direct benefits of arising out of having a plan to deal with disruptive events, the BCP plan can generate other advantages to you, such as integrated management process, right? It often reveals differences between what is supposed to happen in your plan, which is in your standard operating procedures, and what actually happens in the execution. Many times when we look at the operations of someone, whether for health and safety, whether for business continuity, or in a risk management process, we realize that what's written in your standard operating procedures or what should be going on is totally different from what's going on the floor or in the process. Because somewhere along the way, the process has been deviated for some other reason, and this hasn't been documented. And we don't realize what that deviation is causing to the system, because we may not pick it up right away. But in doing this business continuity plan, having to look at things both on a macro and a micro level, you will be able to discern what is going on and what is causing disruptions in your operations, right? And you can generate ideas to be more efficient in the ways that you're doing work. Plan for a crisis. Right now, you're planning for COVID-19. You know it was coming. You know that you cannot be isolated from that. There is no country in the world that's isolated from COVID-19. Whether you have had a case or not, the probability is there. Establish a business continuity management team. Put a team together to help you put this plan together and manage it. If you're dealing with COVID-19, you may want to put together a pandemic team, one specifically out of that management team to deal with the COVID-19 pandemic, as opposed to a hurricane, earthquake, or other types of disruptions. And the reason for that is that the systems that you're going to put in place will be different. They are not similar. Appoint a health manager. Why? Someone to coordinate preventative practices. Worker screenings for symptoms. Communicate new practices within the organization. You hear about the new norm. What government regulations are coming into place and what does it mean to us? Worker training and cross-training. You may have to move workers into different parts of the factory in order to use them more efficiently, either because of their experience or their past training, or retrain them in order that they work more efficiently. Okay? Distribution of personal protective equipment. Not just personal protective equipment for people working, but personal protective equipment to protect you from the coronavirus and from those who may have it or may be carriers of it. All right? Crisis communication person. This should start immediately. They should start writing various types of media releases and releases for your employees based on information given to you by the health authorities, by the various authorities in government, and you will tune it to what your particular needs are, but have them ready. Don't wait for it to happen and then start to write it. Okay? Have a draft done. Keep the draft on file. When you need it, you pull it out, you fine tune it, you send it out. There's no waiting there. All right? Programs for training and cross-training again. I can't stress this enough. I've seen this too many times. Your training needs to be standardized, ladies and gentlemen. Write your training programs down. How do you want the training to go? What are the first, second, and third steps? What are the goals of your training program? What do you want to see come out of it? What skill sets are you looking for in your workers after this training is completed? What improvements do you want to see in the worker's skill set after this training is completed? Many times I have seen during the norm of operations, a new employee comes on board, they're given orientation for the organization, HR, so forth and so on. And then when they're put on the floor, they're put to work with a senior person on the floor who has a lot of experience to give them on-the-job training. Well, guess what? That fella giving them that training, who's been there for 20 years, he trained that new recruit with all the bad habits he has, all the little shortcuts he takes to get things done in his own way. And then the new recruit will also adopt new bad habits on top of that. But if your training is standardized, if your training is done one way, there's no room for bad habits to grow. And don't do training once that they come in and don't do it ever again. Training on retraining should be done on an annual basis or as need. If an accident occurs, go back to your training again to ensure that it doesn't occur again. I cannot stress this enough. Training is very important in identifying those deficiencies in your operations and correcting it. How long can the disruptions last before it becomes unacceptable? How long can you operate at your tolerance level, which is maybe 4, 3 hours, whatever you decide a day, before that becomes unacceptable, that you cannot operate like that anymore? Or if you extended your operations from 8 hours to 16 hours, because now you're looking at more maintenance on your equipment, less looking at more, so probably downtime, more strain on the equipment, more strain on the individuals. So all of these things we have to take into consideration, right? Resources required to conduct your operations, workers, supplies, partners, contractors, right? Other key operations. Establish where threats to your business are driven and by what factor. Who can influence change in the organization? If you have a supplier or service supplier who comes in and every 100,000 hours has to service a piece of equipment, but because you have upped the time in which you are using that equipment from an 8-hour day to a 10 or even a 16-hour day, the hours are adding up even faster. So some preventative maintenance will be necessary other than what is the scheduled maintenance that has both a cost and it also has a downtime to do maintenance. So how do you put that in place? That calls for planning. That calls for change. Okay. There's a grocery stores in Trinidad, some of them, the smaller ones, actually most of them, was extending their lunch hours of their staff, that when after they're finished with lunch, there was an extra half an hour added on. So it'll go to an hour and a half now, so that they can do sanitization in the groceries, restock shelves and so forth. All right. And they found this to be a very, very effective method of keeping the grocery stocked. And they're looking at this now, not just because of coronavirus, but you know what? This might be something we may want to be doing on a regular basis, because the turnover is fantastic. So you need to look at these things. How long can the interruption last before becoming unacceptable? For the employer, for you, loss of capital, loss of material or production, loss of income, disruption to business activities. How long can you deal with each of these things? Resuming activities as soon as possible, minimize losses, maintaining good reputation. How soon can you go back to normal business? You've got to have a date in the back of your head that says that by 6 months, 1 month, 3 months, depending on the circumstances, but you're starting off with this goal, I want to be back to normal operations. If you don't have that goal and you're just going 1 week after the next with whatever is happening and you're going with the flow, you're not going to go anywhere. You need to plan. You need to be able to say, what do I need to have in place? What health requirements do I have to have in place for my workers? What other things, what is new in the workplace that has to be brought on board for me to go back to normal operations? And we'll be talking a lot about that later on in the second part of this presentation. Make strategic decisions, lead to development and management of business continuity plans, allocate and redeploy resources as needed. Remember, I talk about cross-training, moving people back to other departments based on their skill sets, right? Taking care of your workforce. What are their needs? Not just at work, but what also is happening with them outside of the workforce, because COVID virus is not just happening with us at work, it's also happening in our homes, right? Many of us are working from home now, and we're going to talk about that later on. Workers. How many workers can you run the company with at a minimum? Now, one of the things I've always asked companies to do is do the demographics on all your employees. Many organizations will hire somebody, and the information that person gave you when you hired them 10 years ago is the only information you still have on that person. Only if they come in and say, by the way, I have moved from this address, I am now living at this address. This is my new contact number. These are my new emergency contacts, right? Have you updated these records? You must do this annually as a regiment. Send out the form, everybody fill it out. Do it annually, okay? Health, what are your current ailments? In the Caribbean, we are very much susceptible to things like hypertension, diabetes, and so forth. So we will be looking at these things in terms of your employee, because when your employee is under stress and working under a stressful situation, having these type of ailments will exacerbate it. Stress exasperates hypertension, high blood pressure. It exasperates diabetes. Okay, all of these things come into play. If your employee went from being on a diabetic tablet to being on insulin, it means that they're required to take in a certain amount of calories every day and to eat at certain points in time in the day. If that employee misses that break in order for them to put some carbs into their system or proteins into their system, it means that you may have an employee who will faint on your hands during the course of the working day. So you need to understand what are their requirements. If you have employees, I had one client who they work in the field and they go to do surveying in the bush and they go all over the place. But we have to understand, was anybody allergic to insect bites, to stings? Because you don't want a guy out in the bush to get stung by a bee or a wasp and end up with going into shock, and we don't have the means or the first aid available to assist him at that time, or dealing with allergies and these sorts of things. So we need to update our health surveillance on our employees or workers, and also send them for an annual health surveillance. What is their health at this point in time? Especially when you tell the doctor, this is the type of work he does. He does heavy lifting. He works in an area that is a lot of heat. He works in an area where there's excessive cold because he works in a refrigerated area. These sorts of things on that person's health. Trauma. Has the worker experienced any personal loss? It may not be because COVID-19, but at this point in time, when somebody dies, in Trinidad and Tobago, we have a restriction on no more than 5 people congregating at any one point, and hopefully family members only. So instead of having a funeral with 50, 70, 100 mourners, you only have 5 chosen people going to that funeral. I personally actually went on a internet funeral for a cousin of mine who passed away during this time. And what we did was we got together and everybody, the day before the funeral, we got and we just had a talk fest. And when we talked about the person and what we liked and what experiences, it was great. It was almost like being there. So we had our goodbyes. But if you've had that kind of loss, if your employees have had that type of loss and they're unable to deal with it, it is stressful to them. It will cause absenteeism. What if they are the only breadwinner in the family and they come down ill? What if they're the only breadwinner and they have to go into self-isolation? What if they become the only breadwinner because the other breadwinner is no longer there? So it's a one-parent household now. Maybe because of the COVID-19, they have brought their parents to come and live with them so that they can give them better care and not be able to afford the care for them in their own home. All of these things we have to look at. So increased workload, difficulty to reach the workplace because of transportation, increased family responsibilities. We need to ask our workers, so how are everything with you today? Management by walk around, getting that information from them. They're not going to come to you with it readily. Continue receiving salaries, obtain sick leave. What are the other ways they can be paid? What are other ways of generating income, right? A lot of skilled workers, tradesmen, sometimes on the weekends, they do what we call PJs, private jobs. That's how they make ends meet. Besides doing your work from Monday to Friday, Saturday and Sunday, or Saturday, they're doing PJs around the place, making some extra money, but that's no longer available to them. So money has become tight in the household, right? Are they participating in a business continuity process? Are they members of your BCP teams? And therefore the responsibilities to them have increased. And when you're putting people on a team, please stay away from the name of the person. It's not Robert. It is a position that Robert holds is on that team. So that if Robert disappears, whoever moves into that position moves on to the team. Many times we write these policies and procedures and we put people on teams, but we put people, not positions. The position calls for you to be a member of my health and safety team, my business continuity team, my disaster preparedness team, wherever you are, because you're in this position. So whoever holds that position That's the responsibility that they have. Your suppliers, involved in the ability to meet your demand. What problems do, if you don't bring your suppliers into your BCP program and have discussions with them and understand the problems they are also having or they can have, then you are vulnerable to the fact that they may not be able to keep up and give you the amount of supplies. So what are their vulnerability? How can you help them become sustainable so that they can sustain that supply of raw materials to you? What are the other options you have to, up to including another supplier? And they're the best ones to tell you, well, listen, if I can't do it, I will recommend you go to so-and-so because they can give it to you at the same price, whatever the case is. But this has to go into the plan, because you're looking at the disruption of supply chain on the business networks. What if your computer network and your hub is in South America like you are? But whatever hit that southern part of the South American continent will also wipe out your computer hub. So your hub should not be in the same geographical area, or a secondary one somewhere else where your data is safe. So you need to look at that. What is best for you? A lot of people say, oh, we're going to move it to Miami, to North America and so forth. But if you look at North America over the last 6 or 7 years, they have been plagued with hurricanes and storms going up the East Coast. So you need to think carefully, where are you putting this hub for your network communication? Who are you using as your backup? All right? What about your clients? You're unable to meet their needs or the quantity that they want, so they're canceling contracts. All right? The inability to absorb the product and service, or even to go to a new product because you cannot give them what they wanted before. So listen, we are changing things, we're going into this new product. It's a great product, it's a need, there's a demand. Do you want it from us? You have to talk with your clients as well in terms of what you can do for them and what they can do for you. You want to collaborate in terms of the design and integrity of your business continuity program, the strategies, shared information, and you want to know about it before, after, and during a disaster. Support services, third-party services, like I said before, transport in your supply chain, equipment maintenance, people who service your refrigeration, your vehicles, housekeeping, security, all right? Public utilities, electricity, whether you need backup generation and for how long, water supply. I don't know if you have gone into it yet, but in Trinidad, every business has a tap outside of it that they've set up for you to wash your hands thoroughly now, or you have hand sanitizers. But guess what? All that extra water being used on a regular basis, if 500 people went into this business, each one of them wash their hands going in and some of them coming out as well, that's more water. So that's putting a strain on your water authority to meet the demand, especially if your reservoirs are low or it's a time of the year when water is not readily available. So that is something you need to look at. Electricity demand. Yes, the business is closed, so my electrical bill at my office is not as big, but your electrical bill has gone up at home. The kids are home, you are home, other people in your family are home, all 3 television sets or whatever is running at the same time, computers are running, electricity in terms of lights being on, every room is occupied with something going on in it. You know, all of these things are doing overtime. So load shedding could be expected. I am doing this from home because at my office, and we experienced it yesterday, there were brownouts. There was low current from time to time. And therefore my internet connection at some point in times were getting very low. So it was better for me to stay at home and do it where I have a more reliable source. So how can you work with that in terms of that? Impose regulations and standards. What are the resources required for your suppliers, your partners, your contractors? Contact information, key operations. You need to do your due diligence, your ability to maintain the quantity and quality of your product and for how long, and what requirements will be included in the contracts, so that if you do have a contract or you're going into a new contract, BCC planning should be included in there in terms of emergencies, in terms of hazards and risk. List the action to protect your business: people, processes, profits, and partnerships. Again, implementing a proactive preventative measures requires significant changes to the workplace and in the process and practices. So the transition could be a gradual resumption of activities when you're going back, but with changes to it, right? Simplify the logistics, the process flow, all of these things to be taken into consideration. People, lives. We are looking at lives. We are looking at family members. How are the people doing in their family members? Is there some self-isolation going on with the employee at work, at their homes, right? How are the employees coming to work? Are they coming to work regularly late because of transportation? Do they have more responsibilities of home before they come to work now? And how are they dealing with that? How have you set up a safe work environment for your employees once they have come to work? What are the hazards you have identified and what mitigation strategies you have put in place for those hazards? Special needs based on specific threats such as pandemics, right? Washing of our hands, temperature testing, social distancing, all of these things we look at. What changes are needed in the workplace? You may have to look at your flow again and change it, right? Goods coming in, product going out. What is the flow, right? Does it become cumbersome at some point in time where there are bottlenecks? How can we relieve that, all right? And government regulations and standards, how do they impact on your people at work and at home? Process and operations, building and machinery, retrofitting your facilities to meet, like I remember I said, one company went from making alcohol to making hand sanitizers. Equipment needed to meet the hazards, social distancing. If you have a conveyor belt and normally in that operations, you have 10 people working and your belt run at 10,000 widgets an hour on that belt and they are doing quality checks, but now you only have 5 people working the belt. They cannot do a quality check on a 10,000 hour belt. So you have to slow down your operations to maybe 5,000 an hour because it's half of that because of social distancing. So how does this impact on your operation? Enhance personal protective equipment. Folks, I can't stress this enough also. It's personal protective equipment. The only person it protects is the person wearing it. It does not protect the person standing next to them. If one person is wearing a mask and gloves, and the other person standing next to him is not wearing a mask and gloves, the person wearing the mask and gloves is protected. The one not wearing it is not protected. Personal protective equipment is the last equation in the health and safety matrix, but it's an important equation, and that people are trained to what the personal protective equipment protects you from, and what it does not protect you from is just as important. What is the difference between N5 mask and a surgical mask and a cloth mask? What is disposable? What is reusable? You need to talk about these things. Maintenance on equipment, maintenance downtime, maintenance for sterilization in the process. All right, all of these things need to be scheduled, and there's a cost. There's a cost for stopping, and there's a cost for also doing it. Raw materials, receiving and delivery. Where your supplier used to bring the materials and go straight into your refrigeration unit with it if it has to be refrigerated, and put it in supplies, or even come and do their own inventory so they know what they're bringing for you. They no longer can come into your premises just like that. It's not a free-for-all. So now what you are doing is that you are limited their access to your premises. Raw materials come to the loading docks, your people move it from the loading docks into your operation area. That way you limit anybody from the outside coming in. The same thing with exports. While you used to be able to take the final product and deliver it to your client, and even put it in an area where they can easily stock shelves. Now you're going to a loading dock and they will take it from the loading dock to the shelf. I have one client that have what we call merchandisers. They go in and stock the shelves and put up the little sign saying, you know, specials on this and so forth. They too have a requirement to meet in terms of the operation, to their health and safety, to the health and safety of other people within the client's organization, wearing their PPEs, and how they conduct their work, so that their work does not become hazardous to the people, other people using that facility. Many grocery stores and retail outlets have decided to go with a lane segmentation. One lane up, one lane down. There's no more two people conversing in the next lane, because the lanes are only 3 feet wide and therefore they cannot get the 6-foot social distancing. So what do? You enter into one area, you follow the arrows on the floor as you go through the whole situation, and then you come out through another area. So there's a flow, and the flow is a safe flow. So you need to look at that. And what are the changes in regulations? Profits, which is revenue generation. Disruption of negative impact on your clients. The ability to buy your product or service. If your clients normally buy 500 boxes of your product every week, but because of COVID-19, because of situations where there's less income, his sales have now dropped to 3 or even 250. He is buying less of a product from you. You are making less money. What can you do at this point in time? What do you need to talk about him? What other products can you bring to his needs that he never looked at before that you can manufacture and sell to him? The high percentage of goods and services that are on the non-domestic markets, things that you import, right? And the fact that because they're imported, there will be delays in them coming in and leaving. Impact of the disaster on those markets, high-risk areas, raw materials in terms of inflated costs, sales, the final product not selling, right? Failure to meet contractual agreements in terms of you are not supplying the supplier with the quota that they wanted for. So they're going to another person now to make up that difference. Okay, so you have another product on the shelf that is competing with you in the same market. All right, disruptions are negatively impacting on your main suppliers and the ability to supply inputs to your enterprise. Profits on the economic environment. You've not closed down, but you've temporarily closed down your business. You're not a key operations. People are home. Whether they're getting pay or not, I don't know. What is their economic needs, right? What about those who were working for you on a transient basis, all right? They will be day laborers or something like that. How are they making out now, right? In this decrease in economic activity, less money is in the system, may lead to criminal activity or increase in criminal activity. And how does that affect your business, especially in a depressed economy, right? Is there a possibility? You know, everybody's talking about the movement that's going on right now in the United States, where you have people looting and so forth. But I don't think that looting is directly related to what the movement is about. It's related to the fact that people have lost a lot of income over the last 6 months or so, or even whatever income they were getting, and are looking to illegitimate source of income in order to survive. Right? I'm not condoning it. I'm just telling you, you need to look at the other factors inside of them. All right? So there's been a sudden increase in prices, inputs of goods and services, conduct your business, or how you conduct your business operations. Partnerships, enabling the environment to conduct your business. Public utilities, water, electricity, health, sanitation. Remember, like I said, at my offices in Port of Spain, I am getting some fluctuation in power and so forth, which is leading to disruptions. So in order to do this without disruptions, I moved it to home. right? You are doing business from home now, but do you have the internet capacity to do business from home? Do you have an area where you can do business at home? Do you have access to the information that you need at home to make the decisions that you have to make? All right. So all of these things negatively impact on your business and on the markets in which you operate. All right. Third parties, customers, competitors, financial providers. All right. Some competitors have gotten together and said, listen, the market is depressed, whatever the case is, or the demand on the market has gone higher than our production. Let us get together and see if we can make this happen. Let us talk about how we can best support each other, whether it be supplies, production, whatever, you know, working with it. Customer demands. What are the customer demands? At the beginning of the COVID virus, we had people going and buying toilet paper left, right, and center every day. You saw people coming out of various retail and wholesale outlets with tons and tons of toilet paper. Have they used it all up? I don't know. I'm not in their house, but I'm sure a lot of people have toilet paper to last them till the end of the year. So while you had a glut on sales for the first 2 or 3 months, now it has gone down. And we saw that. We saw where people were panic buying because of what was being, what they thought was coming. Lack of supplies coming in and so forth. But the groceries went to their suppliers and they were able to bring in supplies and keep meeting the demands. So the bulk buying and the panic buying stopped, and people are shopping on a regular basis now. All right. Increased negative changes in finance. Your financial institutions, what are they putting in place for you in terms of your mortgage, in terms of your overdraft facility, in terms of your financial needs? Have you sat with them prior to this happening and say, you know, if I ever got into a situation, I am going to require X thousands of dollars in order to keep my operations going. You don't know what government will be doing for you until the time comes. There are some government agencies that already work with hazards in terms of hurricanes and so forth. But in terms of a pandemic, we've never had to work with this before. So therefore, this is new areas, and they're all looking for new instruments of keeping the economy going or keeping the economy up as much as possible. Political and regulatory environment, like I said before, what changes are coming, what new laws or regulations, what the introduction of subsidiaries, rent, wages, all to subsidize these costs, right? But we would not know about this until the government brings them on board. So it's not easy to plan for this. So you plan for what you can do with your finances. And then what happens if we go into a state of emergency? The restrictions of freedom, movement. In other words, your factory has to close down by 6 p.m. in order that workers get home before the 8 p.m. curfew. All of these things are things that we have to take into consideration. Establish a contact list. All your suppliers, secondary suppliers, transportation, another transportation, all these people, you should have 2 or 3 people on this list who can help you do this. Do you remember 2018 when the Ministry of Health banned all meat products from Brazil for a period of time? Well, it greatly affected both not so much the grocery stores, but more so the hotel industries, because a lot of suppliers were getting their meat products from Brazil. Now everybody was looking at alternative suppliers. So everybody was looking at New Zealand, Australia, the United States, Canada, Europe. But the cost of their products were more expensive than getting it from Brazil. So there was a cost increase. There was a delay in getting supplies. A lot of things were happening. So again, we have to don't wait for the impact to happen to start looking at it. Look at it before the impact happens. Make contact with these people, get an understanding of what they can supply you with, quantities and so forth, so that you can make a decision prior to the impact. Update these lists regularly. Make sure the person is still in business, they're still carrying the same products. Don't take it for granted next year they're going to have that product. all right? Also government agencies, emergency numbers for ODPM. This morning I got my first text message from our ODPM, Office of Disaster Preparedness and Maintenance, saying that we are going into hurricane season. Please acknowledge this so that we know it's working and that they can continue to give us updates. All right, so they're on the job. The health department in terms of updates for COVID-19. The labor board in terms of updates for what is available for your employees and on what systems are in place to assist them as we go into this COVID-19 pandemic. Maintain, review, and constantly update your BCP program. If you write this program and you leave it alone, that's it? No. This program has to be updated. As your organization changes, the program has to change. You bring another product online, bring it into the program, go through the same process with it again. You decided to do something new, take it into the program, change it again. You have to ensure that it's improving and the effectiveness is there. Test your plan respective to lessons learned. One of the tests a client of mine did was that they introduced walkie-talkies for communication purposes because they have a large campus between various facilities for disaster preparedness. And when we did the test, we realized that 80% of the people, even though they knew of walkie-talkies, didn't know how to use a walkie-talkie. People were holding the button down and talking while other people were talking. So they didn't know about changing channels and having one channel for priorities, one channel for this, one channel. So we had to bring people in to train them because that was a communications nightmare. People are accustomed to cell phones. I talk, you talk, we can talk at the same time and I'm hearing you. It doesn't work that way. I love doing tabletop exercises. That forces the person who is in charge of that area of operations to think fast on their feet at the table. So if this happens and you've just been told so and so is the case, we don't get supplies, what is your next step? And they sit there and they wonder and they're taking 5 to 10 minutes to make a decision when they should be retaking 1 minute to make a decision because the information is in front of them in the BCP plan. They should have it in front of them. Okay, we are going to do this now. This brings out all those shortcomings in your plan and in people within your plan who need to be retrained. Update your health and safety risk assessment. When you update your risk assessment for your operations, COVID-19 is not just 1-9. COVID-19 comes after each section in your program. If you did your office staff and you did your ergonomics within your office staff and you identify all the hazards within ergonomics, under that goes COVID-19. What do we do? What are the things we're implementing? What else should we go with it? Drivers, security officers, everybody should be in. Each one of them should have an item on COVID-19 and what is required. Strategies for business continuity. What are your strategies? Do we have to realign our strategies with the organization? What has changed in the organization that make these strategies null and void? Your operations and procedures. Many small and medium businesses don't have standard operating procedures. But what I ask you to do at this point in time is to start. Start by just doing bullet points. Don't think you have to write everything out. Do a bullet point. This is first, second, third. This is how it flows. That will give you a start in terms of your understanding of what goes on in your operations and your procedures. Health restrictions. If you're opening back up your business and you're doing testing, right? Washing of hands, wearing of PPE, these sorts of things. And then of course your financial viability by talking to your bankers and your stakeholders in terms of how you're going to fund all of this and carry it through in the event of a hazard. Ladies and gentlemen, those are the 6 steps. I hope I did some justice to that. I hope it was clear enough to you. Vanessa is going to take over at this point where I will answer any questions that come up. Please go ahead.
Thank you, Rob. Thanks, Robert. Thanks very much for that presentation. Of course, the information is a lot. There's a lot to take in, but you have provided some, some information that a lot of persons can use and as they try to either develop their BCPs or review their current BCPs. Like I said in the beginning of the session, the presentation together with the risk assessment forms that Mr. Teelucksingh presented, this will be shared with all of you. Let me know in the chat box if you have any question, but I think generally, Mr. Teelucksingh, of course, the presentation on the risk assessment, there's quite some clarity in terms of how persons identify or allocate the different numbers to the risk profile. I saw one question on the chat saying, what is your conclusion that we have a low risk profile based on? And I think we've seen this question before also, persons wanting to know what information do you base your score on, or your risk profile on? Do you want to touch a little bit on that?
Yes, you will be looking at the information coming to you from your regulatory authorities, from the government and so forth, in terms of what is going on in your community with regards to COVID-19 or any other hazard that's coming up. If you know that you're in an area that is prone to flooding, and that is something that goes on every year, and you know what comes from it and how much of a delay it can cause, you can predict on that. With COVID-19, we're waiting for the government to come to us, the health authorities. Now, be very careful where you get your information from. Make sure your information is accurate and true. Do not use social media. Do not use everything that you find on the internet. Use only those recognized institutions, WHO, ILO, your health department, your labor department, your government regulatory bodies, who will give you the exact information to help you make these decisions. It is a decision-making process based on having information, and that's how you get the information.
Yes, thanks very much, Robert. I mean, we cannot overemphasize the importance of getting accurate information from relevant and reputable sources. And I've seen in most of the countries in the region, the different government departments, either the Ministry of Health or the Ministry of Labor, they would have put together some information to help the people in each country to understand how the government is dealing with the impact of COVID-19 and the kind of information that is required. I have another question here. It says, do the interventions you shared also apply for businesses in the informal sector?
In the
Robert?
informal sector? Yes, it would. Yeah. Yes, very much so. It applies to all businesses across the board, small and medium size, even those that are in the informal sector. If they could be a little more specific in terms of that sector, but yes, it would apply to all businesses across the board.
Yes, and thank you very much, Len, for that question, because we've also seen even the ILO and the research reports that have come out from the different UN agencies, the IDB, looking at the impact of COVID-19 on the informal sector. A lot of you would know that the informal sector contributes the large percentage in terms of GDP of many countries. And with COVID-19, we've seen how the sector has been impacted by COVID-19, particularly when you also look at access to some of the government stimulus packages, or in terms of social protection, access to unemployment insurance and so forth and so on. So the informal sector has been largely impacted in this regard. I'm not seeing any other question. We are now sitting at 11:19. Maybe we should take a break, a few minutes break, so that you can refill your coffee, water, energy juice, tea, and for Mr. Teelucksingh to also catch a breath a little bit, because you've been speaking for a very long time. Then we can come back at, let me see, 20. So in Suriname now, it's 11:20. So we can come back at 11:30.
Okay, great.
In 10 minutes. Thank you, colleagues. Colleague, I think we are ready to proceed with our second part of our session. Okay, so so you are unmuted now. So you can proceed and share the presentation.
All right. Okay, ladies and gentlemen, in the second half of this presentation, we are looking at safe return to work guidelines as set forth by the ILO, the WHO, in a general setting to help you with bringing your businesses back online at this point in time, and what do you need to look at and what do you need to consider. Now, what I recommend to you is that you take these guidelines and you manage it according to the type of organization you have, the setup that you have, which we spoke about before, the flow within your organization, and what do you see, what you have identified in your risk assessment as being the hazards that exist and how you can meld these two together. All right. General consideration should be in particular looking at the workplace layout. That's the first thing I would look at. How is my office laid out? How is my factory laid out? How is my shop, my retail store laid out? How is my workshop laid out? How do I receive? How people come in? How do they leave? How is payments made and that? So what changes that may have to be met to meet with physical distancing? All right. Remember, one of the things I told you, a lot of retail stores in Trinidad are now doing these aisles where you walk up one aisle and walk down the next. So there are no more two people walking in the same aisle in different directions together in order to create social distancing or physical distancing, right? Symptomatic cleaning and disinfecting of workplaces. How often should it be done? It depends on the production and what you're doing. How often are people in there? Different people in and out of that area. One of the things you need to look at is restrictions in the workplace in terms of people visiting you, people not really have any business in the workplace, but you know, in the past they will just come in to say hello to someone. No, all of this has to stop. Okay, you're dealing with your employees, your clients, those people who are your suppliers. Those are the people who are allowed in your workplace now. So you need to start thinking about this and how best you can control this. All right. Disinfecting the workplace. All right. What cleaning is required, what type of supplies you want to use, protective equipment, masks, gloves, these things that you have to have available for your employees and for your visitors and guests. Update existing health and safety risk assessment in light of the COVID-19. Remember I said before, for every sector or every area of your risk assessment, you need to say, okay, what do I do here with COVID-19? What are the steps have to be taken at this area? For each particular steps. There may be a general conditions in terms of the whole plant, but in terms of the whole office, but in terms of each particular piece of operation, what are the steps taken for that, okay? And what are the hierarchy of control measures that you have to keep in mind for developing these programs? Maintain an open dialogue with your workers. if you have a worker, an employee association, a trade union or so forth, which is part of your plant or your workplace, involve them. You want to get that buy-in. This is to safeguard the health and safety of your workers and people within your workplace. So you need to involve them in this, right? It falls as part of your general requirements under your Occupational Health and Safety Act that, you know, that the employer shall do all that is reasonably practical to look after the safety and health of their workers and anybody working in their environment or coming into their work environment. Okay, so the induction of monitoring, preventive measures, protective measures, what needs to be done. Workers can import contributions where they're assessing risk and identifying situations. The question that the person asked earlier about where does this information come from in terms of populating your risk assessment, one of the things is from the employees. When I have to do an operational risk assessment for a client, I actually interview people in the organization, not just the managers, not the head of the operations, but the people who actually do the work. So I have a better understanding on how the work is carried out and what are the risks involved. All right. So that when I do your operational risk assessment, it is accurate to what goes on in the operations. And this is where you will find the differences between your SOPs and what actually transpires and the different risks involved with each of them. All right. Also, so some changes with regard to shifts, teleworking, negotiation with union. If we are sending workers home, well, teleworking has to be part of your risk assessment. All right, we'll get a little bit into that later on. But there are risks involved with having to sit in front of a computer screen or work with a computer from home or even on a phone for elongated period of times when you normally would not have that. Rest periods and so forth. I'm getting ahead of myself. So we're gonna talk about that as we go on. Involve experts. That's what I'm here for. That's what you have through your associations, through your Ministry of Health. There are people through your OSH agencies down there. There are people down there who you can call on or who are experts to help you develop these things or to guide you through this process. And that's the whole idea behind this program with the ILO. Monitor frequently the requirements and recommendations issued by relevant health and labor authorities. So keep up to date with all the activities, all the information coming from your health and labor authority. I did some research. I had to go and screen everything into English and read it and so forth. And there are a lot of things that are happening that they realize that are going on, knowing that you just came out of an election period. But they recognize this and they knew it was coming. And I think both, you know, they were waiting to see, okay, at what point in time do we jump on this bandwagon? How fast do we move with this? But they were getting themselves ready for it. So recommendations coming out of your government authorities. All right, adhere to local laws and regulations. So right now, I think you're dealing with working from home, essential services and so forth. So again, and when you're writing your policies, please put meanings to some of the terms that you're writing, like such as, again, I'm getting ahead of myself, such as when you go to self-isolation. What is self-isolation? Some people feel, well, I have to stay home. So I'm around the kids, I'm around, no. Self-isolation means, yes, you are staying in one specific area or address, your home, or whether it's or a hospital or wherever, but you are isolated from everybody else. So even within the home, there's an isolation process that goes on. And you need to be clear on that. What does it mean? And the period of time, and how do we report it? And how do we monitor it? And how do we know that it's working? All right. Information on training workers. As I said before, write your training programs. Standardize your training programs. Do not leave it up to the individual person to do the training however they see fit. What are the outcomes you're looking for? What is required? So information and train your workers on what is required of them. What are you looking for? What are the restrictions? What is the rationale behind physical distancing, right? Provide information on company policies and procedures and practices related to the management of COVID-19 as you develop them. Keep a register of workers you have participating in the information and sessions and training. So it's just like every other training. Once you have delivered information to your staff, they have to sign that they have attended and they understand what was said, a copy of it, and you put it in a file. Make sure workers are aware of your company return to work plans and procedures based on whether you're doing it on a phase basis, whether everybody's coming back out at the same time, however you want to do it. But you have to make sure workers understand the program and how does it work. If you leave it up to the workers to pass the information between themselves or go from worker to worker, it's going to change. And what you started off with is going to be totally different than what finished. It's going to be a confusion. So you need to control this. Remember what I said. You have somebody to handle communications within the organization. Make sure workers are well accustomed to visitors and they know whom in the company they may contact in case they have questions related to COVID-19. Take steps for the mental well-being of your workers. We talked about the fact that they may have had tragedies in their family, not necessarily related to COVID-19, but at this point in time, where it restricts their ability to interact or to grieve. And therefore, it makes them not mentally unstable, but puts a great stress on them. Everybody, the diversities of circumstance. If within the general community where they live, there are high incidents of COVID-19, so therefore they are even more stressful in terms of what can be done in that area and so forth. You need to keep up to date with it, all right? The tendencies to de-risk the situation. As we enter into our third phase and we start moving forward to the fourth phase, because we have not seen any more local diagnosed cases and there have been no more deaths, people are becoming very lax. The government has allowed businesses and government offices to reopen to a certain extent. But because of this, a lot of people, and exercising outside, a lot of people say, well, it's done. It no longer exists, so I don't have to wear that anymore. So there's a tendency to de-risk the situation, all right, or take away from it. And we have to watch out for that. Managers need to repeatedly emphasize the ongoing requirements of preventive and protective measures within the organization on a regular basis. Toolbox meetings every morning before the start of work. That is one of the ways of ensuring it. Hygiene measures, washing of hands. We have many videos even done by the head of the WHO showing you how to properly wash your hands. That it should be done for a certain period of time. The use of water and the type of soaps you should be using, the kind of products that are available to you. Respiratory hygiene in terms of the mask. What are the difference between, you know, the disposable masks, the reusable ones which have to be washed regularly and so forth, all right? Cleaning of workplaces, sanitization of equipment and facilities. You need to have a schedule and an inspection done regularly to ensure that it's being done properly, all right? Ventilation. The WHO recommends that as much ventilation as possible of air flow within the organization, as opposed to air conditionings and buildings that are closed down and locked up tight, so that you don't have that much of a spread of the virus. And again, personal protective equipment, which I spoke about, I can't emphasize that even more. It is to protect the person wearing it, not the person not wearing it. Okay, so because I have it on doesn't mean that you are safe, because you're not wearing your personal protective equipment. All right, worker vulnerability. What diseases, right, this new disease, what are the risk factors for severe illness? What has come out from many of the health organizations throughout the world is that people who are older, people who have serious underlying medical conditions are of a higher risk factor. At one point, they said that kids were not at a high risk factor, but now it has turned around that there is a different type of risk factor for children. How do we deal with that? You go back to your health surveillance of your workers, right? Who is on, who has a heart problem, who is suffering from asthma, who has diabetes, who have physical ailments, and so forth. So what can we do to further protect them in our working environment, and what advice we can give them to protect themselves at home, right? Advise the workers who belong to groups. Try to, if workers have to work as a group, try to limit that to the smallest amount of people. Where people are vulnerable to COVID-19 and they show any sorts of symptoms within a group, you need to have them consult with a doctor immediately, right? Doctor can access cases and make recommendations for particular preventive activities, right? Including work incapacity and so forth. So we can use either your company doctor or the local health department to help you with this. Preventative measures could also include teleworking, reassessing of workers, of tasks entailing lower risk to the coronavirus 19. If you have a worker who's been working with you for a number of years and you consider him of a higher risk because of age or ailments, and right now the area in which he works is high risk according to your risk assessment, can you reassign him to another area that the risk is medium or even low of contracting the disease? So you're not sending the person home, you're reassigning them where they can do other work, but do it in a safer environment. And that's one of the things that you need to look at first before you consider any other measures for the employee. Doctors can advise and increase preventative measures even at home that the workers may need to take. All right. Medical conditions must be kept always confidential. That's between you and the employee and the doctor. Okay. Actions to consider. Before leaving home in the morning, if you get up in the morning and you have the symptoms, fever, dry cough, sore throat, shortness of breath, head cold, runny nose, whatever, do you have COVID-19? I think you need to be seen by a doctor and that determination made. It could be that you're just suffering from allergies. I wake up in the morning with sneezing, with a runny nose, because I suffer from allergies. So in the mornings, based on the dry dust in the area right now, a lot of different things are happening. I get up with my allergies inflamed. So I have to take my medication for allergies. But if the medication is not working and I realize these things are continuous or more severe as the day goes on or the days go on, then I have to look at going to the local health center and asking them to do an assessment. Once you have done that, you need to inform your supervisor, your employer of what is going on with you so that they can do the appropriate measures in terms of you coming to work or not coming to work. Check the guidance from the health authorities on some of your workers, self-isolating. I remember I said, make sure you give good understanding what does that term mean, right? And the situations that could occur with the workers both at home and under quarantine. Transport to and from work. If there's a short distance, encourage workers to walk to work by foot or even carpooling. That could be a way of doing it. But again, you have to go with social distancing. Because the car holds 4 passengers doesn't mean you put 4 passengers in the car. You may only be able to take 2 passengers, 2 in the back seat and the driver, because of social distancing. All right. So whatever your government or your regulatory authorities have said for social distancing while traveling, you have to put that in the context of your personal vehicle as well. You have to take it that way because you have to protect yourself, right? You may have to look for additional car spaces at work if your people are coming back out to work, because more people may be driving to work than taking public transport. And even with the parking in the parking lot, social distances, 2 people coming out of the car in the same area, allowing the other person to leave before the next one comes out. Walking in the parking lot or in pathways towards the facility, keep social distancing. Remind workers about the importance of maintaining good hand and respiratory hygiene before and during after travel. I personally carry the Clorox wipes in a little plastic bag in my car. I carry 2 bags, one for dirty, one for clean. So even after I have come out of a facility where I wash my hands and I use hand sanitizer, I may go a step further, wipe down the car door, the windshield, not the windshield, the steering wheel, all the surfaces that I touch, and then wipe my hands and put that in the dirty and dispose of it. So there are some things that you can do for yourself to further your safety, right? Remind workers about the importance of maintaining good hand hygiene, right? And if an employer provides transportation or bus, what are the requirements for sanitizing that van or bus, right? Minimum recommended distances of well, now it's 2 meters, is 6 feet between each person, all right? The number of persons that can be fit in the transport. If it's a 10-seater transport, right now you may only be able to carry 5 or 4 people, including the driver. The driver needs to be also isolated from this. Ensure the wearing of face masks, the use of hand sanitizers when coming on board, right? How often do you need to sanitize this transport? It may be running extra shifts in order to carry more workers to and from the factory or to work. And therefore it needs more sanitization at the end of each shift or transport, right? Consider increasing the frequency of transport to reduce congestion. Pay attention to proper ventilation, having the windows open as opposed to the air conditioning on in the vehicle. Cleaning the vehicle regularly, as I said, frequent cleaning due to high volume of use. Separate the driver in the front seat from the remainder of the vehicle. Ask passengers to enter and exit the vehicle through different doors. You may if you have a rear door, you may say, okay, the latter half of the bus will use the rear door for entrance and exit, and the front half of the bus will only use the front door. So you don't have all the same people going out the same exit all the time, and you reduce congestion there, all right, and avoid overcrowding at these access points. Consideration before entering the workplace: temperature checks. Now, I have a little bee in my bonnet with this temperature check, because a lot of people use these laser thermometers, like if they're using a pointer on a chart, or it's a laser tag game they're playing on their computer and so forth. It's a laser. It may not be a surgical laser that does cutting, or a industrial laser that does cutting and welding and so forth, but it's still a laser. If you read the instructions on it, they have clear instructions on how to use and where not to point this laser at. You cannot just put this system in place at your front door and expect people to know about it. There must be written warnings, there must be signage. You must have a clear spot where the person, which is on the ground, and you will ask the person, we have to check your temperature. Please stand here, look straight ahead, close your eyes, and I am doing it now. So that the person does not open their eyes or shift, and by accident, you end up hitting them in the eyes with this laser. It may not cause any damage, but prolonged effects can. Read the instructions on these laser thermometers, please, when you're using them, and make sure that the person using it has been trained to use it. And you don't just hand it to the security officer at the front door or somebody and say, okay, you do monitoring of temperatures now. And you need to keep a record of it, because you need to know how many people have you done for the day. Out of 2 of them, what is the average temperatures you're looking at coming into the plant? All right. Registering entries and exit. You must have some register, whether you have electronic register that once you walk through there, you are electronically registered into the organization, or you have to sign in a book. Avoid congestion at these exits. So you may have an entrance on one side of the plant, the northern side, and have an entrance on the southern side. You may have 4 entrances. You may have 4 entrances and exits. Whatever you can do to avoid congestion. Having floors leave at different times. Depending on the number of people working in the plant, you will let them go at various times in order to avoid this congestion when people are leaving at the same time. And again, promote good hygiene habits on the workplace. Changing rooms. Make sure changing rooms are disinfected on a regular basis. Make sure proper distances are in effect with workers who are changing. Another thing with changing rooms that I like to bring up is that workers who wear special overalls, uniforms, such as if you're working in a hospital and so forth, or if you're working in the oil fields, or if you're working in factories where you're exposed to hazardous chemicals and so forth. You should not be wearing these overalls to and from work. You should change into your street clothes when going home, because you are taking whatever you picked up, whatever hazard, whatever you have in that workplace, and transporting it all through your route on your way and into your house. I recommend highly that if the workers are responsible for maintaining their overalls and uniforms, you wash them separately from everybody else's clothes. I cannot emphasize that. We had a situation in Trinidad and Tobago where a guy was working near or around an area where there was asbestos, and he got some of the fibers in his work clothes, and it caused his daughter to have a very severe allergic reaction to it, and they couldn't figure it out. All right, it took a long while before we realized what it was. Again, coming home in his work clothes, she runs up to him, hug him up with whatever he has on, and whatever comes off went directly onto her. Okay. Ensure regular cleaning of changing rooms in case of any between shifts, and constant monitoring. Bathroom facilities. Workers must wash hands before and after using the toilet. That's a standard, but a lot of people don't. Physical distancing. I saw a picture the other day of a large bathroom urinal for men where every other one was closed off, and actually closed off where they put a plastic bag over it and taped it down so that nobody will use it. So you had social distancing. But I'd like to bring another point up, which is not here. That is, when you use a toilet or a urinal, close the lid on the toilet before flushing it. When you flush a toilet, you create particulates, right? Or aerosols, as they say. And that comes up into the air. You breathe it in, it gets on your person, it gets on your clothes. So by closing the lid, it is one of the ways of controlling it. It is one of the training that we give to people, janitorial services people who clean toilets. When they do that brush and they're doing that squishing inside of there, we tell them that that's not the way to do it, because you're causing the water to come out of the bowl. Don't flush the bowl while you're cleaning it. After you're finished cleaning it, you cover it and then flush it, right? Men, when you're using a urinal, it's the setting on the urinal, the automatic flush setting, automatic flush, works when you walk away from it. If you flush it while you're standing there, you are flushing all that water and whatever is in the urinal onto yourself. Be aware of that. All right. Again, between sinks, social distancing, provide liquid soap as opposed to bar soap, hand towels as opposed to regular towels, all right? Or even electronic dryers. We refer to electronic dryers. It does not always dry your hands totally dry. There's moisture still in your hands, and within that moisture, we can still carry bacteria and other infectious diseases, all right? So you want to make sure that your hands are properly dried, and towels are one of the ways of doing it. Ensure regular cleaning of the bathroom facilities. There are people who come in and maintain it on a regular basis between shifts, and not just at the end of the workday. Canteens and rest areas, right? If you have on-site canteens, you have to manage it in accordance with the measures we are going to bring to you. Avoid workers leaving the site sometimes. We may not have an on-site canteen or eating place. We may have some place for them to eat, but they buy their meals from vendors who are either on our compound or outside of our compound, right? Once you are coming into the compound, you are subject to the same hygienic measures all over again. Washing your hands, wearing your dust mask until you're sitting down to have your meal, okay? Even wiping down the box that the meal come in as well, as a form of hygiene control, all right? Remember, workers, to wash your hands in the canteen. Determine the maximum number of people who can safely stay in the canteen at the same time. Again, physical distancing measures. Implement staggered lunch hours or rest breaks to avoid congestion. Split workers into teams or shifts to avoid different teams of workers in the same space at the same time, so that you can have that. I know that they don't want to have lunch together. That's when they socialize, that's when they talk, but this is about being safe. Set up canteen areas to maintain physical distancing. We spoke about that. Chairs and tables. Make sure also to these chairs and tables are properly what? Sanitized at all times. All right. The availability of serving from common food sources. If it's a self-serve canteen where the food is there and you come and you serve yourself, you may need to look at changing that into a service canteen where the person behind the food counter is the one doing the serving. So less people are coming in contact with the spoons and the food, and therefore there's less chance of contamination. Also, in common areas where microwaves are, that your microwaves are properly sanitized as well, and the least use the better. You might even consider bringing in food vending machines that have prepackaged food, you know, to just easily grab and go and eat. Things may change, all right? If the person brings food in and they bring in their own containers and so forth, that they follow the sterilization practices as required, and try to reduce cash payments, the handing over of cash and change and so forth. So all of these exchanges are things that you can look at to control in your canteen and rest areas. Keep dining room areas hygienic and clean. Be aware, even when you go into small restaurants and stuff to eat, instead of cutlery and tableware and glasses, try to use disposable utensils so that once you are finished with it, it is easily disposed of. One less way of contracting it. Regular cleaning of keyboards, all right? Beverage and snack dispensers, placing hand gel or cleaning wipes in relevant areas, having hand sanitizers at the entrance and exits to all departments helps a lot. Or giving out personal hand sanitizers so that they can do it whenever they move around in the department. Workstations, production lines, where you can promote telework, where people don't have to be in the office. It's a great way of maximizing functions, but it also calls for physical distancing rules with respect to your present workplace. In the context of your office, right, creating sufficient distances between workstations and people. You may have 4 people sitting in a cubicle. So now you may have to do social distancing, and you may be able to get 2 people in that cubicle. And how does it work? All right, rearrange workstations in a way to maintain safe distancing. Certain desks in open spaces. Some workstations are separate and spare rooms. Workstations where people work back to back rather than facing each other. So even if the person is wearing a mask and they cough, there's less likelihood of the airborne pathogen going towards them. So you're not facing each other. All right. If social distancing is not possible, first of all, use collective personal protective equipment such as plastic screens, walls, compartmentalization, of workspaces, organizational measures. I know now when I go into pharmacies, groceries, any store where I have to purchase something, when you get to the cashier, they have these plastic screens in front of them to further separate them from you, even though they're wearing masks, and I am wearing masks. And in some cases, they're working with gloves. In terms of teamwork, consider limiting the size of the team. Keep the membership fixed. Don't let people come in and out of the team. If there are to be meetings with other people outside of the team, it can be done online. Where your team has to get together to strategize, make sure they work in a very large environment where they can separate and do their job, and while maintaining social distancing. All right. If one team member gets sick, consider quarantining the whole team until you have found out basically that the person does not have it and therefore they are safe. All right. Team functions are critical functions in particular areas. You have to look at the location of the teams, Are they in the same area, the same office, the same factory? Because again, we have to do tracing in terms of where these teams work, who they were in contact with, and the possibility of passing on the virus. Right? Apply for markings for safe distances between workers, just as you do it in a retail store. You can do it in your office. If in your office, let's say you have one major thoroughfare going down the middle of the office, and it may be wide, it may be 6 feet wide, and you have desks on the right-hand side and desks on the left, you may consider that once you do social distances, creating the office area in such a way that everybody walk in a singular direction, starting entering on the right or the left and exiting on the right or the left. And that way you have one flow going on instead of people passing close to each other all the time. All right. Where you have situations where work has to go from one department to the next, and it's not electronic, but it's physical paper or other product. One person doing that delivery, not everybody getting up from their desk and taking the work to the next department. No, let's label it. Let's put it in such a way that it goes into a container. If we have, remember banks used to have these air things that you put your container into a plastic tube and it shoots it into the next department, that sort of thing. But you may not have that or want to put that in, but go back to having one person pick it up and deliver it so that you have control of how many people going in and out of the department and what is going on. All right. Work equipment, right? Work tools being provided by the company, especially when you're sharing tools with another worker, right? Try and discourage or prohibit that where they can. If it has to go on, these tools must be sanitized on a regular basis. Encourage employees of having their own tools and using it on the job. All right. I know in many mechanics, in small ones, they use the same tools. In larger ones, each bay has its own toolbox. But things just also go back and forth and people borrow. But we have to ensure that we use social distancing, we use sanitization when lending things out, we wipe them down clean, we sanitize them before using them or giving them to someone else. All right. Contact logs. All right. The simplest is a list, date, name of colleague, department, who you're going to visit. Right? If you have this type of thing between floors, between departments and so forth, you can keep track of workers and where they're going and observe minimum distancing rules no longer than 15 minutes in each department. What you can do if you have electronic cards, that when you can limit where people can go, because with the electronic cards, you can key them out of certain areas so that they don't just go walking through departments aimlessly. All right. People get habits from working in an environment for long periods of time, for years. And therefore, you asking them now to change these habits. And it's very difficult. I train people for emergency management. And no matter how much we try to train people to use the emergency exits, when the alarm goes off, I guarantee you, 60 to 50% of the people go to the exit that they came in. If they're accustomed coming in one entrance and one exit when they leave the work every day, when the alarm go off, they are going to head for that same one. That's why we try to do drills all through the year and by department and walk people through emergency exits so they get accustomed to using it. It's very difficult to break these trends when people have been doing it for many years. All right. Logs can be used to establish a list of tasks that cannot be achieved using physical distancing, and you can see exactly how work. This can actually tell you, how your work is flowing. Is there any way to improve this workflow, whether it be paper, whether it be a product or a service between departments? Internal circulation, right? Restrict that as much as possible. Instruct workers not to go from room to room, from place to place. We spoke a little bit about that just now. Respect to physical distancing, moving across workspaces for the full, not as fully extended as possible. Maintain or avoid using elevators. Even if you're using a staircase, and you can use one staircase for going up and one staircase for coming down, as opposed to even if the staircase is 8 feet wide or 10 feet wide and you have enough room for social distancing, sometimes it is better to have one staircase being used for an entrance and one staircase being used for an exit. And that will help a lot. With regards to elevators, it's not how much the elevator can carry, but how much the elevator can afford to carry with social distancing. So where you had 6 or 8 people in an elevator, you're now down to 3. Right? Enable as far as reasonably possible separate circulation of circuits of workspaces, floor markings, tapes, indicate safe ways of clearing. Remember I said one-way spaces going in and out in the same direction. All right, consideration one-way traffic. We discussed that. Consider introducing one-way traffic in corridors, rules of both sides and in and out of the building, for example. What exits do you use for leaving? What entrances do you use for coming in? You may have to want them both on the same side or opposite sides of the buildings in relation to parking lots, in relation to workstations and facilities, so that the person who walks the shortest distance. Many times we did not lay off our parking lot in accordance with the operations of the plant. So people are parking far away from where they normally work. They may be in another building. So what you would want to do is limit that movement by rearranging who parks where, so that what you're creating, one, is the least amount of movement between departments and areas. Wearing of face mask at all times, and again, hand sanitizer, and following the recommendations of your national authorities. Meetings and travels, again, what meetings you can postpone, please postpone it. If you can do it online, that's even better. Suspend any meeting required the presence of greater numbers than, let's say, 4 or 3 people, or what the national requirements are. And even when you're having those meetings, you are using personal protective equipment at all times. Okay. Daily kickoff of meetings or toolbox meetings by having a quick talk, just like how you would have a meeting and somebody will get up and talk about the emergency exits and the fire warden and to follow our instructions if there's an emergency. You will talk about what are the requirements for being in the building at all times, what you should and should not be doing, places you can and cannot go, and how we expect you to behave while on our premises. Right? Consider keeping a list of contacts in terms of the people who came to the meeting and participating in it for at least 14 days to facilitate tracking if necessary. Meeting rooms have to be maximum number of people and sterilized after each meeting. Desktops, tabletops, chairs, doors, handles, everything needs to be sterilized or sanitized, I should say. All right. Instruct workers to wash their hands before exiting the workplace. As much as possible, spread out exit times to avoid congestion. In case of transport organized by the company, make sure that the vehicles are properly cleaned before anybody is transferred, and workers wash their hands upon arrival at home. Again, I can't stress this enough. If you use your uniform in a factory setting and a part of it involves using chemicals or hazardous materials, or even if you're working in a hospital setting especially, change before going on to the local transport or even in your private car and driving home, so that when you get home, this garment is already in a bag in the back of the car to go straight into a wash bin and be washed and cleansed, okay? You don't want to leave it lying around anywhere for any length of time. Partnerships, suppliers and deliveries. You need to study protocols for receiving goods and services, people coming in, who is allowed, who is not allowed, right? Protocols for offloading and for loading and unloading goods and services, right? What are the possible risks through your COVID-19 self-assessment and the risk assessment? And what do you need to put in place for all suppliers and workers in between that? Limit the number of workers designated to handle deliveries. Like I said before, you may receive it, it's on the loading dock, and then your people take it from the loading dock or from the door into the business. As before, the supplier used to bring it directly into the business. What you're trying to do is minimize the amount of people entering and leaving your facility, okay? And what is desirous? If you are working with this, constant washing of our hands when after touching the product, putting the product on shelves, sanitizing the shelves, the work areas, the spaces, and so forth. Clients, right? When you restart your operation, especially if you're in a if you're in a multi-story complex, such as a mall or a building that has several various businesses, so people are using a lot of common areas such as entrances and exits. Again, once they get to your office, the policies you have implemented for your office in terms of wearing a mask, washing of hands, sanitization, and so forth, it applies. Okay? Even though the facility has it, your office should have it as well. What are you doing? You're minimizing the possibility of contamination. All right? Quickly check for any official requirements, recommendations, or limitations on people in your operations. What are the government saying about that? Put up signs. Don't just tell people about washing. Put up the sign. The sign is right next to it. Wash your hands, showing them the hands with the soap on it. You have the sign with the mask to be worn. If you're going to do a temperature check, you can have a sign that shows that temperature checks are done at this point. People need to be aware of this so that when they do are stopped or asked, they can't say, well, I didn't know I had to do that. So please, signage is very important all through the facility where these things are taking place. Where you have up a hand sanitizer, put a sign about it. Hand sanitizer must be used before entering. Caution, hand sanitizer must be used before entering. All right. And also signs for social distancing, safe hygiene, and so forth. All right. To protect staff and customers, limit congestion, determine the maximum of people that can be used, that can stay simultaneously inside your premises, and try to follow these guidelines. Where you can reduce the number of people, please do so to the proper physical distancing. Allow for the limited number of people at any given time, designate staff member to carry out this control. A little bit about that, train your staff member who's carrying that out. Huh? I was in a mall a couple of days ago. I went to pay a phone bill and there was a line and I joined the line. And right outside the door to enter into the cubicle to pay the bill, there was the hand sanitizer and a sign saying that you must have on your mask. But everybody had on their mask anymore. But the security guard chose to take you off the line, okay, and make you now line up again to use the hand sanitizer and then go back on the line to go into the place. It made no sense. But in her mind, that seems more her way of controlling things. Have your policies and procedures and train people on how you want this done. Otherwise, they're going to come up with their own ways of doing it. And it's going to be totally different from what you're accustomed to. And it may cause you more problems down the road. So make sure that the people that you ask to monitor this and to be monitors for the situation, that they know exactly how it is to be done. So they don't come up with their own plans on how they want it done. All right, that's very, very important. Training is important all the way through. All right, and understanding what is your maximum capacity and to control that capacity at all times. If you have people waiting outside your premises to enter your premises, make sure physical distancing rules apply, whether you put markings on the floor or you have up signs or signs around things that they can follow, that they can see. All right. Avoid flow. If you can avoid people lining up to come into your facility and you can make appointments to come so you can control the number of people coming in the facility or having to wait to come into the facility at any point in time, that would even be better, wherever you can do that. And again, providing alcohol-based gels at every entrance and exit of the premises. All right, with respect to partnerships, the only thing we can really touch on here is putting up plexiglass barriers for people as right, the reception areas, the checkout areas, those type of things, making sure people are wearing their face mask and taking into account, you know, what is recommended by the national authorities. All right. Consider taking orders online by telephone in advance, so you have pre-pickups after it's been paid for. Consider a delivery service if possible. All right. If feasible, allow customers to empty the premises only by appointment. I said that earlier. Okay. So now we are looking at stressful situation for workers. Remember, we spoke about the worker having situations at home that have changed. Either they have brought their elderly parents into the house, so there's more people in the house, less space, and there's more responsibility within the house falling on the worker. So how does that, especially during the pandemic, how does that influence the worker when he comes to work, right? What is the state of his mental health? How is he stressed, right? How are they feeling? Can they become irritated quite easily? So you need to watch this, because let me tell you, this is a stressful situation. Many people may feel being at home is great, but being at home can be more stressful than being out of the house, because you don't have the ability to leave the house whenever you feel like it and to do what you want to do. So all your outlets that you used to have no longer exist. So you're looking for new outlets. You're looking for new factors of finding peace within yourself. It is very, very important that you talk to workers about how they deal with being at home, and go to the regulation authorities and to the people who know about this, who can give you ideas on what to recommend to your workers to do in order to help them de-stress. Right? If you can carry out employee surveys about how things are going at home, see what the problems are. If a lot of your workers all work in the same general geographical area, they may be all having the same problems, and therefore there may be a way of solving it by getting together in small groups and helping to come up with ideas on how best we can deal with this. All right. Teleworking from home on a full-time basis, equally stressful. Okay, you're constantly on the computer or on the phone. I was watching a program the other day where a woman said she doesn't know when 5 o'clock in the evening comes anymore. So sometimes she finds herself all kind of 7, 8 o'clock still working at home. All right. Again, it can become stressful. You need to take your mini breaks. Think about us right now. We're doing a 3-hour session. We needed to take a break so that your brain can work and absorb what's coming in the second session. And I'm not sure if I have all of you with me right now anyway. All right. But really and truly, when you set up your routines at home, your time for work, your time for family, your time for yourself. I cannot stress that enough. Time for yourself. An activity that is good for you to de-stress the anxiety that comes with working such long hours. I even find that some people are finding themselves working on a weekend as well. Okay. How can you support your own mental health for the periods? Keep regular schedules of work, designated workspace. All right. Like I said before, because of the browning of the electricity problem I'm having at my office, I choose to do this from home. But while my desk at home is comfortable for me to do some work at, I can't do prolonged periods of time here because it is a cramped space. All right. So it's not made for long-term working areas. All right. Set boundaries to avoid unreasonable hours, as we spoke about that. Also, too, what goes on in the house at the time when you are doing work. You may need peace and quiet. You may need to have the internet system, because your internet system at home may not be as powerful as the internet system in your office. So therefore, if too many people are on it at the same time, you start to get spooling, and it slows down your work process. So all of these things are things you need to consider when working from home. All right. When workers are placed on a temporary layoff scheme, what can we do to assist them? Well, one of the things is get them involved in activities to pick up on that time that they have for themselves. right? The activity doesn't necessarily have to earn money, but it has some fulfillment in terms of what they're doing and gives them a sense of purpose and belonging. Because the worst thing for them to do is to sit down at home and just think, when am I going back out to work? What am I going to do with this? What about that? What about money? What about this? What about, you know, that's where the stress comes in. That's where the stress comes in. All right. Supporting workers in temporary layoffs, some of the things that inform them about significant job, having sessions online to talk about jobs that are available in the area that they can do temporarily, what the government has to offer for you in terms of services to help you both financially and otherwise. Is there a hotline or a line that you can call where you can talk about the stress that you're having and speak to a professional to help you with this, right? And I said earlier, consider such activities like volunteering, online training with workers and so forth to help the development during that period of time. I know a lot of people that are doing online courses at this time to develop their skills. Workers who continue to work at your premises, again, it's important that the workers who work on site are fully aware of what safety precautions need to be. Communication of hygiene measures are critical. Also be aware of special circumstances where the workers may be in a career, and to discuss the possibility of adoptions that they may go into a flexi schedules or reduction of work times and so forth. Check your established national and local health authorities in terms of what guidelines they're giving you for that. In your plan, you have to talk about what are the symptoms of the coronavirus and what do you do once you feel you have the systems. What is the follow-up? How do you inform the employer that you're doing this? And what are the decisions taken by the medical provider in terms of whether they're going to isolate the worker or allow them to come back out to work or work in a particular environment, all right? And ensure PPE, surgical masks, gloves, all these other things are available for workers if in case workers do get found to be infected on the job place, right? If there's an emergency where workers have severe symptoms such as shortness of breath and so forth, emergency health services immediately. Who makes that call? Do you have the number for them? They come immediately. Do you put the worker in an isolation room? You know, what do you provide for them? You do the contact tracing. All these people need to be notified that they need to isolate immediately and then be seen by the health provider and be tested for coronavirus if possible, or any kind of communicable diseases that may be coming around. All right. Clean areas affected by workers online using the public health authorities. There are companies that do these sanitization and sterilization. Sanitization and sterilization are two different things. All right. Sterilization is a very deep cleaning using particular types of equipment and cleansers and so forth, while sanitization is a general wiping using things with alcohol in it and soap and so forth, just to clean the general work areas. So make sure you know what you're doing and follow the instructions of your health authority and collaborate with any persons doing any investigation from the epidemiological investigations from them, so that they know what is going on when they're doing tracing, so that you have your logs ready for them to look at. You know where the worker went, what areas they worked in that day or for the last 14 days. Ladies and gentlemen, that concludes this portion of our presentation on returning to the workplace. I will take any questions that you have at the moment. Thank you.
Thank you once again, Robert, for another very comprehensive presentation on some of the guidelines that could really inform some policy at the workplace in terms of how employers prepare their workplaces for reopening of businesses. As we noted in the beginning, you know, Suriname currently they are under lockdown. Of course, they're waiting on government information in terms of the extent of the lockdown, the duration of the lockdown. But persons are now working from home. I have one a question here, and it's relating to the initial presentation of business continuity plans. The question is that the practical examples that you have provided, Robert, they are with regard to companies in production or retail sectors. But is a business continuity plan possible for companies in the health sector, like, for example, laboratories, where there is a direct contact with potential infected persons?
Oh, definitely. That industry, more than any other industry, requires business continuity, because the likelihood of you losing an employee due to cross-contamination or infection is greater than in a factory or other units, because you are working directly with biological units. Including in your universal precautions and in your various precautions for the different types of testing that you're doing, you will that will be included in your BCP plan. So you will just be adding another layer to the level of protections that you have in place by putting a business continuity plan in place there. And it goes hand in hand with what your requirements under the Health Act and under the international standards for laboratories and for working with various types of pathogens. Now, remember, you have to look at it on an individual basis. Bloodborne pathogens versus airborne pathogens versus this versus that. So when you start looking at all of these different pathogens that you work with, different types of diseases, each of them will be recognized in your business continuity plan. And what is the highest risk? How would the mitigating strategies? And if it does occur, what will you do next? Right? Are you going to outsource that service because you cannot conduct it for the next 30 days while an investigation and cleaning goes on, and sterilization and so forth? Or is it that you can isolate that area for a period of time and conduct that service as another part of the building with other trained staff? So there's a lot of thought that goes into what you are talking about there. Thank you very much, because healthcare was my field earlier on in risk management, and it's part of it.
Thank you, Robert. And I think the following are just comments, not necessarily questions. Like I said, in Suriname, there has been 0 cases for some time. So initially there were like 10 positive cases, and it went down to 0 for some time. And now all of a sudden, boom, 50 plus cases have been reported, which has also resulted in the government requesting businesses to close down. You spoke earlier on about, the mental health of COVID-19, and in a situation where it seems like the country is going forward and then backwards again in terms of contamination, or just trying to flatten the curve, what the kind of psychological impact that this virus has on persons, especially when the country seemed to be moving in a right direction and managing the COVID-19 cases and reducing the number of those cases. Then all of a sudden, boom, you have a lot of community infections. The psychological impact of it.
If you remember correctly, in one of the slides, we talked about de-risking, where because you have reached a stage where you have everything under control and there are no more cases, and you haven't seen a new case or infection in weeks, almost a month. So we have done the right thing. We did the social distancing, we did the isolation, we did all the testing, and we were on top of this. People tend to drop their guard. So they stop wearing the mask, they stop doing social distancing, they stop doing a lot of different things. And the cases may not come from within the country. It could have been people coming into the country or people traveling. Now, remember, you share borders with several different countries, and not all your borders are patrolled. I'm not saying anything derogatory about the government, but the ability of people who are coming in there. I'll give you a for instance. The Prime Minister of Trinidad and Tobago announced on Saturday that we are going into phase 3 because we had no new cases Everybody in the hospital who was under surveillance have been sent home. The country is at a point where we can move on. And the next morning, we got people in, Trinidadian citizens who came in from outside. And of the 10 people coming in, we have 2 new cases. So understand that you have to keep the vigilance going. You cannot drop that vigilance standpoint. I know it's very stressful, but you have to continue with it for a period of time so that you can have it under control. The United States right now is bracing for a major second pandemic based on what's going on now in terms of crowds and demonstrations and the lack of social distancing and the lack of wearing of PPEs and so forth. So the powers that be are saying, we're bracing, we're waiting to see what happens in July and August. All right. Yes, that is the social impact on the community is rough because you went through it, you thought it's over with, and then all of a sudden here you are again. And this is where I'm sure your health department and your government services have professional services to help businesses and to help the private sector deal with this type of impact, that you have an outlet to talk about it and to help you deal with these services. In businesses, you can have what we call an employee assistance program, where there are professionals who help talk to employees about stress outside in the business and at home, and it's done on a very confidential basis. I don't know what exists at this point in time, but you need to look at something like that.
Thank you. And we have another question, and maybe Kamlesh, if you have some information on this as well, it might be useful. And the question is, what have some other companies done during partial or full lockdown with regard to collecting payments from clients who cannot pay online?
They actually went and talked to their clients and said, look, this is the amount of money owed to me. What can you do at this time? Because we know that, you are not doing full business, or you're not doing business at all at this point in time. You have a wage bill that you want to carry for a couple of months, and you have no real income coming in. And in some cases, some companies barter services in terms of their service in IT, their service to the other company, so that, I don't have to pay for this anymore. I'm getting it for free, and we agree on a cost for it. And in some cases, they agree on a payment schedule, which will allow both companies to exist and able to meet their financial agreements. Again, you have to sit and talk with your suppliers, with your clients ahead of time, and come to an agreement of what you can and cannot do and afford to do.
Thank you, Robert. I don't see any other question or comment on the chat box. I'll just maybe wait a minute or two. If there aren't any questions or comments, just to repeat again that the presentation, the risk assessment documents, the link for the recording of this session will be forwarded to VSB, and VSB will share all that information with you. I know that now that you are back at home, most of you are teleworking. Let me just also indicate that there are many other tools that the ILO has developed to help you with conducting your business during this period. One such tool is about how to manage teleworking. And I think if you can, visit the ILO website and go through that, it will help you in conducting your work during teleworking. There was another question that I missed. It's about total lockdown. Robert, there are some experts that believe that it does not actually work. For example, again, in Suriname, where they had partial lockdown, they went from 0 cases and now at 50 plus. The question is, how much does a total lockdown actually help? Sorry, you are muted.
Right. I really can't answer that question. I don't have the expertise to answer that question in terms of whether or not total lockdown or partial lockdown is an effective measure for coronavirus. I take my lead from the WHO, and it is it's one of the pillars that was recommended by WHO in terms of dealing with it on a community basis. It has been very effective in other countries, like here in Trinidad and Tobago and other Caribbean countries. I know it has been very effective. So I really don't want to say that it's good or it's bad or it is partially. I'm not in a position. I don't have that kind of data available to me. I'm sorry. But I do take my position from the WHO, and they recommend it highly.
Thank you, Robert. Just hold on. I see something else again here on the chat box. At how many? At how many active COVID cases would you advise a company to close its doors? Note that the company would have implemented 90% of the measures you have mentioned in the presentation.
That will come, that decision should be made in conjunction with your health authorities, because it's not just that case alone. It's when you do the tracing of that case and how many persons that person may have been come in contact with and the possibility of infection by more people. That is where that determination will lie. It's not just if you have 4 or if you have 2 or 3, I'm shutting you down. No. When we do the tracing, and if the tracing shows that this person or these people have come in contact with a large majority of the people working in your organization, I think collaboration with your health authority is where that decision would be made. It is not a cut and dry situation.
Thank you. I'm not seeing any question. Colleagues, everybody, I think we had a very useful session. I hope you enjoyed it. I hope you got as much information as possible out of the session. And I hope that what has been presented here today will assist you in increasing your resilience, in not only as companies, but also broadly as the country. We appreciate you joining us for this 3-hour session. And many of you have stayed locked on for the entire duration. So we really appreciate that. If once we've sent out the recording, the presentation, and the risk assessment forms, if you have any question, I would encourage you that you send those questions to VSB, and Kamlesh can coordinate the questions and send them back to us, and we will try with the facilitator to respond to some of your questions. So that is something that we can assist with. I don't see any other questions, so I'm going to stop our session at this point. Thank you so much. Thank you, Robert. Appreciate your...
Thank you very much, Vanessa, for monitoring. I know you're doing this all by yourself today, and it's a task, but we did a great job, I think.
Excellent. Thank you, guys. Bye-bye.
Bye-bye.